Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there are no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 45-year-old female with a BMI of 32 presents for a routine checkup. Her fasting blood glucose level is 115 milligrams per deciliter, and her A1C level is 6.4%. She has no symptoms of hyperglycemia. According to the ADA guidelines, what is her diagnosis? Is it a normal diagnosis, B, prediabetes, C, type 2 diabetes, or D, impaired fasting glucose? Take a moment and tell what you got, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure that you're answering what is even being asked of you. So here, the stem of the question states, according to the ADA guidelines, what is her diagnosis, right? And as I always tell y'all, if they are asking for a diagnosis, you need to run it back and look at the assessment findings. So we have a 45-year-old female, BMI is 32. So that is considered overweight, right? And her fasting blood glucose is 115. Her A1C is 6.4. Instantly, y'all should start to think about this. This is right on those, as I tell you, like those Brink parameters. So the best answer is B, pre-diabetes, right? Because we know an A1C of 6.5% is considered type 2 diabetes. She's right there on the cusp of that. And that 115 is also for that fasting glucose is right there close to the 126, right? So the best answer is B, pre-diabetes. Remember your pre-diabetic ranges also. All right, and question number two, a 60-year-old male with a newly diagnosed type 2 diabetes has an A1C of 9.1%. He has no history of cardiovascular disease, but is overweight. He is otherwise healthy and has no contraindications to oral medications. According to the ADA guidelines, which of the following is the most appropriate pharmacologic therapy to start with? Is it A, metformin, B, insulin, C, sulfonylureas, or D, a GLP-1 receptor? Take a moment and tell me what you got, you guys. All right, so stem of the question here says, according to the ADA guidelines, which of the following is the most appropriate farm treatment to start with? So, when we talk treatment, I always say, look to see if they have provided you with a diagnosis. And in the event that they have not, you need to run it back a step further and look at those assessment findings so that you can determine a diagnosis, right? But as you know, we're going based off of the ADA guidelines. So we know there's some type of diabetic diagnosis, right? And it always tells us that this patient was newly diagnosed with type 2 diabetes and the A1C level is 9.1%. So, what is our first line therapy for our diabetics? Your best answer is A, metformin. Do not get hung up because we have simply told you it was a new diagnosis, A1C is this, and think that you need to go a different direction. Well, we start with metformin. Now, I know we do have some questions, and because some things say start insulin at 9, some say start at 10. And I always tell you guys that we go based off on the guidelines that they're testing you on for boards purposes. Now, practice, you know how to navigate on a patient by patient basis and looking at the parameters that's going to work in that current situation, the benefit over risk, right? But based on the ADA guidelines and board preparation purposes, 10 is the A1C that we start insulin on, okay? For this one, we want to still go with our first line therapy of metformin, okay? Question number three, a 50-year-old male presents with symptoms of increased thirst, frequent urination, and unexplained weight loss. He has a family history of type 2 diabetes and is overweight. On exam, his blood pressure is 130/85 and his BMI is 32. A random blood glucose test shows a value of 210 milligrams per deciliter. What is the most appropriate next step in confirming the diagnosis of type 2 diabetes? Is it A, repeat the random blood glucose test in 2 weeks? B, perform an oral glucose tolerance test? C, perform an A1C? Or D, start treatment with metformin and monitor the blood glucose levels? Take a moment and tell me what you got. All right, so stem of the question here states, what is the most appropriate next step in confirming the diagnosis of this type 2 diabetes? So let's see what we got going on. Still, in this sense, we're trying to find a diagnosis, right? And I always tell y'all, when we're looking for a diagnosis, you need to run it back and look at those assessment findings. No different here, even though you're trying to figure out what next steps you need to do to confirm the diagnosis. So here in our assessment, we have a 50-year-old male. He has symptoms of increased thirst, frequent urination, unexplained weight loss. Classic presentation for diabetes, right? He has a family history of type 2 diabetes, and he's overweight. His blood pressure is slightly elevated, 130/85. BMI is 32, confirming that he's overweight. And then a random blood glucose test is greater than 200, right? So we need a second step because we, based off of the ADA guidelines, we go by the criteria of your fasting glucose, your rapid glucose, your glucose tolerance test, your A1C, all of those things. Two of those being positive is a diagnosis for diabetes, right? So we already have one with that random glucose being greater than 200, right? So we need another. So we don't need to repeat the random. You could perform an oral glucose tolerance, but this is not going to give us a variance because that's still more of a random guideline. So the best choice here would be C, to perform an A1C, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. All of the things that I do offer are linked in the bio of this channel, as well as my website. But y'all know, I always tell you guys, if you're looking to book any one-on-one sessions or to work independently with me with any of my custom plans, I always say either call, text, or email, as I offer a variety of one-on-one session types. So I prefer to speak with you to gauge what you truly need to make sure that you are booking the appropriate sessions. I have removed that off of my website because I think it was getting too confusing for you guys. And I just want to be sure that you're able to book the appropriate thing. As always, y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.